Hi there, welcome to this video. This is a video on how to get a transcript from your medical college for the primary medical qualification like MBBS. Are you looking to go abroad for work or for post-graduation after finishing MBBS? Are you required to provide additional evidence of your MBBS qualification? If you answered yes to both these questions, congratulations, you're in the right place. This video shows you what you need in your transcript for your undergraduate qualification. Before you apply for the transcript, you need to check a couple of things. Number one, check if you actually need a transcript, because not every country requires a transcript. They usually accept your medical qualification, the degree or diploma as you call. And if you do require a transcript, check what are the minimum requirement, specific requirement that they expect in the undergraduate medical education. They may have a specific minimum number of hours of study or total number of years of study, either in correspondence or face-to-face study. So different medical councils in different countries have specific requirements like that. It's important that you check prior to applying the transcript so that you know that you actually can go there and you qualify for that. So once you checked that you do need a transcript and you fulfill the criteria, what format do you go for the transcript? Well, any format that works for you is the right format. There is no one right or wrong way of doing it. There are many formats of doing the transcript. I will show one of the formats that worked for me and others in the recent times towards the later part of this video. But if it fulfills the requirement for you, then that is the right format. The one that I'm going to show you has been proven good enough for US, if you're going for USMLE exam, or to apply to UK. If your college is not listed in GMC, the General Medical Council, then you may have to apply via your transcript to them to include your college on that list. So in UK, this also applies. I'm sure the transcript that I'm going to show should also apply for other countries like Dubai, Canada, Australia, and New Zealand. If there is any new information that you are aware of, please let me know in the comment section. So what do you need in this transcript? The transcript, you must know, is not just one document. It's a collection of a lot of documents. So to start with, you need a transcript that describes how much hours of study you did in basic medical science and about your clinical clerkship. Clinical clerkship is the clinical postings that you did in your second and third MBBS and final MBBS. Internship, in some places they call it as CRRI. And the final medical school transcript, so kind of a cover letter to go with it. The hours certificate, that's the most important document of all. You would have to check how many hours of theory and practical experience you had in your MBBS qualification, and an official attempt certificate that lists how many attempts you took to complete your exams from the first year to the completion of the final year. There are two more documents that you need, but that's not a mandatory, it's a supplementary document. Number one is the name expansion certificate. Many people, for example in India, use initials instead of surnames. And when you go to a foreign country, the main documentary identifying evidence is your passport, which expands that initial and gives you a surname. So you will be using your full name, that's your proper name, and then expansion of your initial, that's your surname. So in order to avoid confusion, it's best to get a document saying that your initial means whatever it means, and it's the same as what it shows in your certificate. For example, Joe B might be expanded as Joe Bloggs, and you could get a certificate from your college saying Joe Bloggs and Joe B are both the same. And the last one is the clinical postings confirmation document. Again, it's not actually required for you to provide to the medical councils of the country that you're going to, but this is for the office purpose in many medical colleges. They need to know that the departments have approved the dates that you are shown in the medical transcript. So this is something that can change and applies to different colleges. It certainly applies to GMKMC college. So these are the documents that you will need. While applying for transcript, the first thing, go to the medical education department and explain them why you are applying this transcript and give them a written request if they require one. Make sure you check the fee. Again, different colleges have different fee. Some colleges charge, this is in South India, Tamil Nadu, some colleges charge about 5,000 rupees and some colleges charge 4 times that, up to 20,000 rupees as far as I'm aware of. So check in advance so that you can prepare yourself to avoid any surprises or shocks later in the line. If you're required to do all the work by yourself, you would need to know where to go, who to ask, and how to get it. The first and foremost, the most important person in this process is the registrar in the medical department. This is the case in GMKMC, or who is the person who hold a record of all the clinical postings that you did. In our college, it's the registrar in the medical department. So go to them and politely give them a ask for this, and maybe write a request to have all the clinical dates and the postings details from them, and create a document that lists all the dates from the first year up to the final year. And you need to get it assigned by the registrar and also by each department staff. It doesn't have to be a HOD in all those departments. It could be done by the assistant professors as well, if they are willing to do so. So once you've done that, before you complete, you might remember that I mentioned our certificate is the most important document of it all. So to know how many hours you actually studied, you need to check with the university curriculum the total number of hours of study. It includes theory and practical, and you need times for both of them separately. If you had finished your MBBS a long time ago, the university curriculum might have changed, so you may not find that information online, in which case try with the registrar in the medicine department again, or try to find a senior or your colleague who might have applied for a transcript in the past, and they might have that information for you. Once you got that information, you can input all those dates and the time accordingly based on the format I'm going to show you now. And this format actually applies to everyone, although the actual format I'm going to show is from ex-GMKMC student. Right, the documents I mentioned, the first one, basic medical science, it looks like that. I'll just skim through it first and then show it in detail in a bit. Then clinical clerkship document, CRRI or the internship, final medical school transcript, which is just a single sheet of like cover letter, and our certificate page, name expansion, that's a supplementary document, official attempt certificate, and the posting confirmation document. So let's go back to the very first one. So the basic medical science document, what it does is to inform you or who the transcript is going to, when did you do the basic sciences, anatomy, physiology, biochemistry, pharmacology, patho, micro, and forensic medicine. In this case, this person has started in August 1998, finished the first year in July 1999, started the second year, pharmacology, pathology, micro, forensic, in August 99, and finished in January 2001. That's the 18-month second year. So you need to have a specific format that applies to all these documents. So to start with, get the logo of your college, like it's mentioned here on the top left-hand side, and also get the name and details correct on the title of this page. And it has to look official, because this is actually the most important official document. This represents your basic medical qualification, so you had to get it absolutely right. And you had to mention who the dean of the college, that's the current dean, not the dean when you qualified, and the vice principal if you have one. These numbers apply to the GMKMC, so those students who watch this video, if you're from GMKMC, these telephone numbers, the fax number and the email number applies to you, and you can use this one for your document. So I hope you can see this clearly. This is the official transcript of medical curriculum for MBBS first and second MBBS. That's the basic medical sciences. So let me take you through this. This is to certify that Dr. Your name was a bona fide student of Government Mohan Kumar Mangalam Medical College, Salem 636030, who did his bachelor of medicine and surgery MBBS course from, and here you put your start date of your first year until the end of final year. And remember, this end date is not the completion of your internship. This is the completion of your final year. Medical student qualification is separate from internship. Although for many people in India and GMKMC, we would have to complete the internship to complete our medical qualification. The dates that go here is the end of final year when you take your final year exams. And it can be approximate if you don't remember the specific date. For example, if you did the exams in January, if you don't remember the exact date, say January 2003 or 2004 or something like that. And then it goes on to say he has satisfactorily completed the instruction course of 1, 2, and 3rd MBBS of the Tamil Nadu Dr. MGR Medical University, Chennai. And it's important to mention your university name here if the university has a lot of different colleges, like in this case. The medical council in the foreign country need to know which college you studied, in this case GMKMC, and which university it's affiliated to. It's also mentioned in the title, but it's important that you also mention in the context of the transcript as well. And it also goes on to say when this doctor did his internship, so start date and finish date. And this date here, the second paragraph, is the CRRI date, that's the internship date, not the MBBS study date. And it's absolutely important that you get all these dates correct and exactly the same in all the documents that you had to provide. So you can go with this format: serial number, the subject name, period, when did you start, when did you finish, and the head of the department. The final column here, the head of the department, this is not a mandatory field. Some people prefer to do that, some people omit that. It is individual preference, so if you don't want it, you don't have to put it there. And then at the bottom, you get the office seal and date and the dean's signature here. So this is a rough estimate of how a basic medical science transcript should look. I spent a little bit of time here so that you get the understanding of what needs to go on these documents. The paragraph mentioned here will be similar in other documents as well, so I won't spend much time in the other documents. So let's move on to the next document. That's clinical clerkship. Similarly, that's you need to have the title, logo, and the contact information right at the top and visible. Okay, so this is the clinical clerkship, the clinical postings that you did from the very beginning of when you started to see the patient. So in this case, from the second MBBS, so July 1999. So say who you are, where you studied, and which year it is, so second MBBS or first clinical year, starting from the very first day. And here the format is divided into different semesters, or if you want to call that, or based on the vacation period. If there is any gap, you need to explain why there is a gap in the clinical posting. So explain what discipline, what the specialty you went to, which hospital, when did you start in this format, date, month, and year, from 2 dates, and also the head of the department or supervising professor. It's useful to have this the head of the department column here, even if you didn't go for this in the previous document, because it looks official and nice. To avoid any confusion, you would have to take it through your calendar as you actually did. You should not collate all this together. For example, there's the intensive medicine introductory course, and then there's a proper medicine placement here. It is wise not to combine them together. So go through all the placements that you did without missing any of them, even if you did it just for a week or 2 weeks. First page is for the first clinical year, that is second MBBS. So include all the postings that you did in that year on the first page. When you go to the second page, then it's the start of the new training year. So the second clinical year, it's also called in this college as third MBBS Part 1 or pre-final year. The header is the same with the logo and title, and similar structure. Start from the beginning of the clinical postings and mention all the postings that you did in second clinical year, including the vacations. And once you finish the second year, go to the final year. That's the third clinical year, or third MBBS Part 2, as it is called sometimes. So similar structure, all the clinical postings from the beginning, without any gaps, include the vacation. And once you're completed, have the dean's signature and official seal and date. It's useful to have the dean's signature and official seal and date in all the pages, so that it's a proof that every information in each page is has been validated by the office. Move on to the next one, CRRI document. So CRRI stands for Compulsory Rotatory Resident Internship. So that's a different format to this title, but it's the same information: logo, college name, affiliation, dean, vice principal's name, contact details. And the information here is similar to the ones before. So what is your name? When did you start the MBBS course? And here goes the date and start and finish date of your internship. And you have to make sure that all these dates are exactly the same across all the documents that you're going to provide. And in the internship document, you can actually combine the dates so that it's sorted based on the clinical department that you worked rather than the date. Okay, so in this case, you might see medicine, there are two different dates. If there are two different dates, you can combine them together. So if you're done like a month in June and a couple of months in September, you can combine them together, so they will know that you did 3 months of medicine altogether. Make sure that you provide the information in a very user-friendly manner and easy to follow it through. Okay, if there isn't any overlaps, or if you haven't done the postings again, you don't have to combine them. So similarly, I mentioned the HOD's name here. What's the dean of the medical college? I think this student mentioned this last column here because there is a change of dean while they were working as the intern. If that wasn't the case, you don't have to mention this column. Okay, you can take them off. So this continues, and these are the other departments they worked and from when and to when, who the department HOD was at that time. So now we have covered the basic sciences, clinical postings, and the internship. And the most important document, you might remember, is the hours certificate. How many hours did you study? Get the logo, contact details right at the top. And this information here, these 3 paragraphs, will be the same across all the pages that I'm going to show now. So you can include it as a header if you want it, except this bit. So this says page 1 here, and it will say page 2, 3 as we go to the next pages. So it starts from the very beginning of the MBBS experience: anatomy, physiology, all the medical sciences. So how many hours of lectures did you have? How many hours of dissection and demonstration, the practical experience, did you have? The same goes for all the specialities right to the very end of your final exam, final year. So you'd have to check this with your medical curriculum, university curriculum, and get these hours exactly right. This is the most strenuous task. You would have to do a lot of homework and calculate the exact hours you worked and you studied based on the curriculum and the timetable that you got earlier from the registrar. Okay, and this total number of hours will be calculated, and many medical councils in the country that you're going to will have a specific requirement of the final total number of hours for MBBS qualification, and you would have to qualify by having more number of hours than they require. So sort it out by the subjects that you studied, starting from the first year, second year, moving on to the third year, part 1, community medicine, and then the clinical postings that you did in those years, and then the subjects that you did in the final year, that's the third MBBS part 2. Okay, include all the subjects that you did, even if it is just 1 week placement. Like radiology, you could see just 20 hours of studies, but you did that, so it must go in your transcript. So let me take you back so that you can see what are the subjects mentioned here. Anatomy, physiology, biochemistry, pathology, micropharmac, forensics. Those are the main subjects in the first couple of years. Community medicine, that's in third year. And then skin, dermatology, venereology, leprosy, that comes under skin. Tuberculosis and chest medicine, psychiatry, pediatrics, and for all the specialties you had to mention the hours of lectures and the hours of bedside clinic, the practical experience. In community medicine, there are different types of practical experience based on the subjects covered. You could either go to this level of detail if you prefer. If you don't want to do that, you can combine the lectures and then practicals, just 2 lines instead of so many different lines here. And moving on to the final year subjects and the third year, like internal medicine, surgery, ENT, ophthalmology, orthopedics, radiology, dentistry. Again, you see there's only 10 hours of study, but you had to mention that because it was part of the curriculum and you did that, so you had to mention that if you did it. Anesthesiology and obstetrics and gynecology. So get them all together, and for ease of calculation, you can put the total in bold letters beneath every subject, and if you want, you can combine all those together at the end. It wasn't done here, but if you prefer to give a final total number of hours, you are free to do that. And it's also useful just to give a statement of good conduct at the end. So this is one of the most important document of your transcript, so make sure you get it right in terms of the hours, and also make sure the dates you mention here correspond to the dates you mentioned in previous documents. Final medical school transcript, and this is more or less like a cover letter that goes with the other documents that we discussed so far. So it just says who you are. This is to certify you who underwent MBBS course at your college affiliated to the university, and when did you start and again here the start date of your MBBS and finish date of CRRI. So this is a complete course including your internship if you did it. If you did it elsewhere, just mention the MBBS here, because you would have got a separate letter from the college where you did from the hospital where you did the internship, and say that you have satisfactorily completed the instruction course of MBBS. He passed his final MBBS. When did he pass the final MBBS? Mention the date and year date, month and year if you know the date, or just month and year should suffice. Also mention that you have completed the CRRI or the internship successfully, and mention the dates of your internship. And the last sentence, you don't have to mention it all the time, but if you prefer, you can include it. It says when the degree was awarded. For example, in GMKMC, for this student, he qualified and the degree was awarded 4 months after he qualified. So you can mention that. But I know one of the students who qualified and the degree was awarded, the certificate reached them after a year. So that would confuse the medical council when you submit this transcript. If you say you finished a year earlier and got the degree a year later, but you were registered with the medical council, so you could mention the registration date if it is earlier than the date of degree awarded, if that makes sense. Okay, and again finish with a conduct statement saying his academic record is good, conduct is good, and character is good, if that is the case. I hope it is. The supplementary documents are these ones. Name expansion certificate. So I gave an example of Joe Blokes, Joe B. So in this case, if you say your name.I, if that is how you are known, is the bona fide student of this college from when to when. So that's when you finished your final MBBS, not the internship. He did this internship, so separately mention the internship date and say what that I stands for, or if the I comes at the front, it's the same. So something like this. Make sure you get all the combinations here. So I, your name, or your name I is the same as your name initial or initial your name. It's a kind of silly document, but it's useful to have with you if somebody got confused why you have an initial in certain documents and you have the expansion of that in other documents. The next one is the official medical transcript or the attempt certificate. In Tamil Nadu, in India, when you apply to the university for transcript, I was told this is all you get. You don't get all those hours certificates, so it's not actually good fit for purpose to just have this. So this is important in addition to the other documents that we discussed, but this alone won't suffice your requirement for transcript. So this just say when you did your when did you take those exams and whether you passed on your first attempt or second attempt and which year you took those exams. The folio number is the certificate number. You could find these on your actual exam certificates, and this is a fictitious number of marks that this person would have liked to score, I guess. Good marks. So what's the maximum mark, minimum marks, how much this person scored, and get it signed and sealed by the dean's office. Okay, and when you submit all these documents to the office, they would want evidence to make sure that you're not falsifying your information. So provide a copy of all the certificates that you have to them so that they can confirm all these marks, the dates and the folio number and the hours you worked are all correct. The posting confirmation is a supplement which different colleges might require just for office purposes. So when you go to the medical registrar in the first place to get all the details of the clinical postings you did, get them sorted out in this format based on the year and the department you worked under. So first clinical year in medicine, surgery, under different departments, you worked from this date to that date. Get it clarified with the registrar and make sure you get it approved by him or her, so that when you go to different departments, the specific corresponding departments, they know these dates were checked by the registrar, and they can also, if wanted, check with their own register and sign and seal to confirm that this was the right information. So that when all these rows were signed and sealed and approved by the department, you can submit this to the college as a proof that these dates were correct and they could approve your transcript. The office is very particular about having this document, and without which they cannot approve your transcript. So make sure you have something like this signed by the registrar in the first place, so that you can take them through different departments so that they can sign as well. Okay, I hope this video was useful. If you require any other clarification on transcript, or if you have any doubts, if you need any other videos that might help you, please comment in the comment section. And if you like this video, and please feel free to like it and share it, or subscribe to my YouTube channel, and hopefully you get your transcript in due time, and good luck for your career. Take care.